Hi there, my name is Robert Mazure and I'm a naturopathic health practitioner. As a naturopath, I treat people with a range of common disorders such as high blood pressure, type 2 diabetes and IBS for example, using a combination of different healing modalities which I integrate together. So in order to develop myself as a naturopath, I'm going to India for 7 months where I'll be visiting a number of different naturopathic hospitals, also known as nature cure hospitals, where patients are treated exclusively naturopathically. So what that means is that patients are treated exclusively without the use of pharmaceutical drugs. So for example, I'll be visiting the world's leading yoga therapy research centre, where they use yoga therapeutically for a wide range of different conditions. I'll also be visiting a hospital that uses fasting to treat their patients, also with a very wide range of different common disorders. I'll be visiting a hospital that specialises in the naturopathic treatment of kidney failure, where there they gradually wean their patients off dialysis, and I'll also be visiting a hospital that has state-of-the-art hydrotherapy facilities. So why am I actually going to India? Well, for the last 25 years, naturopathy, or nature cure as it's also known, has been recognised by the government of India as being a distinct system of healthcare. So the hospitals I'll be visiting are also recognised by the government of India. Patients go to these hospitals specifically to receive treatment that does not include the use of pharmaceutical drugs. Before we actually continue on to the documentary, I have something that I'd really like to share. Yoga is used in naturopathic hospitals in India also because of its ability to nourish people on an emotional level, and we all know that our emotions, our stress levels and our stress cycles are really influential over our actual health. And we've all heard of stories of people that have introduced yoga into their lives and experienced dramatic results, dramatic shifts in their lifestyles. For example, improved sleep cycles, improved quality of sleep, dietary habits have been modified, and also stress levels have been really managed much better through the practice of yoga. And in effect, it actually changes who they are as people and who they are for the world. So when I was a teenager, I really needed that emotional nourishment because for me it was totally absent. However, instead, I took a really destructive path that had some really profound consequences. During one of the interviews I conducted for this documentary, unexpectedly I happened to open up about that experience that I had, and I'd like to share that with you now. And I think that the effects of yoga on the nervous system, on the mood, on the way that we interact with each other, are so astoundingly clear. I mean, that's one of the primary reasons that it's become now installed in prisons.
Yeah, I mean, we understand how these practices provide transformation for people that really need it. You know, people in prisons really need it.
I was one of these kids that needed that sort of help when I was young, and I went off and I operated in a bubble of absolute oblivion, had no idea of, had no goal of my own, had no sense of direction, had no grounding whatsoever, and I got myself into a heck load of trouble, and I ended up in prison. In 1996, I was 21, I was there for 4 years, no, I got given 4 years, I was there for 2.
For what?
I suffered from an abject lack of self-esteem when I was young. I had absolutely no self-esteem whatsoever at all. And I noticed that when I look back, I mean really and truly, I just wish I was sort of like upset, but in a sense I'm not upset because I've got to where I am through where I was. But I sort of like wish that I had someone like me to talk to me when I was a kid, sort of thing. You know, but like I noticed when I look at my sort of behaviour at school that I became naughtier and naughtier and naughtier and naughtier. And so until I had to find myself a suitable group of kids to hang out with that also had a complete absence of self-esteem whatsoever. And we were like a very bad bunch of kids that had like no compassion for other people, no idea of cause and effect, no idea of no empathy whatsoever. And so like I'd get myself arrested here and there and all that sort of thing, and then we'd have like feuds with like other kids, and then eventually we were threatened and as a result of that, we thought that we'd try and sort it out, and somebody ended up losing their life from it.
I'm sorry.
Yeah, and so I was put in prison for 4 years because of that, for the role that I played.
You're like one of my best friends.
Thank you.
And I trust you with my life. I really would. And so to me, it just seems a very conceptual thing that you went through all this, because I've never known you any different to what you are now. So do you think it was actually necessary for you to go through that, to kind of learn something? And
It is interesting that you asked me that, because I remember when I was discharged from prison, I finished my sentence, I left prison, and I had this inkling of a feeling that was very present at the time, and I really recognised it, that I wanted to go back to prisons and actually help people there.
so then your life would turn full circle, wouldn't it? You go back and contribute to those people.
That's exactly what I need to do. That's exactly what I planned to do.
Yeah. So that's beautiful, really.
So I'm actually bringing up my own personal story. Well, I think I'm actually a pretty good example of the transformation that's available to people when we welcome yoga into our lives, and I don't actually want to be the only person that benefits from it. So presently my entire life is committed to healing and empowering other people. And I am somebody that wants to make a big change in society. And how do we change society? We change society through changing individuals. And how do we actually change individuals? We change individuals at the grassroots level in schools. And a great deal of my effort has been spent interviewing some of the world's leading figures on the benefits that children can receive through the introduction of yoga into the school curriculum. So I'm very passionate that the experience that I had as a teenager can be used to help all of our children so that we create a healthier and much happier society. And now we're going to hear from the world's leading experts on the healing modalities that are used within the practice of naturopathy and what health itself actually is.
World Health Organization has made two changes in the whole of approach towards the health. The first change that they have made is the focus should not be sickness, but it should be health. It's not mere absence of sickness, but it is positive well-being. And that, in the second step, they have taken it to a high level, saying that it's not just physical well-being, mental well-being, social well-being, and ultimately is a spiritual well-being.
That's very, very interesting. So the World Health Organization say that the state of health is not merely an absence of illness. So that means if you don't have a particular illness, but you have a lot of stress in your life and very bad social relationships, that's really not healthy.
Right.
Naturopathy is a system of man building in conformity with the constructive principles of nature on physical, mental, social and spiritual planes of well-being.
Quickly describe the treatment modalities that you use here in this hospital.
Yeah, we are having hydrotherapy segments, we are having nutrition and dietetics department, including fasting therapy and juice therapy. We are having mud therapy, we are having acupuncture, we are having acupressure and heliotherapy like sunlight, chromotherapy, magnetotherapy, like
massage therapy,
massage
yoga
therapy, of
therapies,
course, yes. And we are having counseling segments also.
Right.
Because stress is a very important factor for almost many of the diseases.
Yeah, absolutely, absolutely.
Naturopathy yoga is special because it treats both body and mind. Naturopathy for the body and yoga for the mind. This is the only system of medicine which can take care of the mind. It can prevent many diseases, cure many diseases, relieve many kinds of diseases so that we can enjoy with the complete health.
In this section, we're going to learn about the principles that guide the practice of naturopathy. We're going to meet a few patients receiving treatment, and we're also going to meet the distinguished Professor Alex Hankey, a lecturer at the world's leading yoga research centre. He'll introduce himself now.
I got a scholarship to Trinity College, Cambridge when I was 17. I got straight firsts in natural sciences tripos with a part 2 in theoretical physics. I went to Massachusetts Institute of Technology, MIT as it's known. I did a PhD in theoretical physics in both quantum field theory and elementary particle physics for the first half, and critical phenomena, the study of critical instabilities in various kinds of thermodynamic system, for the second half. and I then spent a year at Stanford before joining Maharishi International University, founded by Maharishi Mahesh Yogi, the man who took the Beatles to India. All organisms have to have the ability to heal themselves. This is because organisms live in challenging environments. Challenges from the environment can cause strain on system function. The strain on system function results in various degrees of pathology. And if an organism is to remain competitive, it has to be able to restore the system to optimal function from what has been caused by the challenges in the environment. So for any organism to survive in an ordinary ecosystem, it has to have the ability to be able to restore optimal function, which is health, and therefore it has to be able to heal itself.
The disease itself is an elimination process of the body.
Right.
Disease itself is a remedy. Body starts repairing itself.
So you're here with ankylosing spondylitis of the hips. So ankylosing spondylitis is where there's a fusion of bones. It's more common to have it in the cervical vertebra, but this gentleman has it in hips. So before he was admitted into this hospital, he was actually unable to walk. Is that correct?
Yes.
So you're unable to walk for how long?
Almost 1 week.
And you told me that actually you've been suffering from this problem for some years now.
Almost one and a half years.
And now you're able to walk. And now the pain's reduced a great deal?
It's a great deal.
So a great deal is no painkillers.
No painkiller. I have stopped the medicine after a couple of still it's in my bag, but I have stopped.
Why have you decided to receive naturopathic treatment?
Almost everybody knows. Though it takes time, but it cures fully. But this naturopathy can regain the body strength of the. But after coming here due to yoga and how they are teaching like that, the spiritual way they are giving, it's really helpful. It really boosts the mind.
So how are you feeling now?
It's really good. I feel really,
So you feel a lot better?
really better.
Very, 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 very good. I'm very, very happy for you.
The body has 4 important channels of elimination. The bowels is the major organ. We also have the kidneys, we have the skin, we have the lungs, and of course the liver plays a very important part in detoxification. For example, treatments like which help in sweating, perspiration, like steam bath or a sauna bath, are again very beneficial in opening up the skin channels where more of sweat is secreted and detoxification occurs. Exercises like lung strengthening exercises or respiratory exercises
Like pranayama, yogic.
like pranayama are very beneficial in maintaining the health of the lungs and improving the elimination through the lungs. There are treatments which are diuretic in nature, which are helping in increasing the urine output in the body, and this urine output will also help in removing more and more of toxins.
So you've come in with pain in your knee, osteoarthritis of the knee, and also an enlarged prostate gland. So you're experiencing what symptoms? How is it affecting you?
I cannot walk freely. It's very difficult.
So you have a lot of pain in the knees.
Yeah. I cannot freely walk.
And also urinary function. How's that affected? Do you have pain passing urine?
Pain, no. Passing urine is difficult.
So actually passing urine is difficult, but you don't have pain?
Pain, no.
So you have to wait a long time for the urine to pass?
Yeah. Freeness is not there.
Right, so there's retention of urine is there. So why have you decided to come to a naturopathic hospital instead of going to an allopathic hospital?
What doctor says, you have to stop the medicines. Otherwise you will get the side effects.
And in naturopathy, it is said the accumulation of morbid matter is the basic cause for the development of any disease. If the bowel activity is not proper, when the toxicity is very high in the body, the toxins are very high in the blood. These toxins, what will happen is, they start settling down in the different systems of the body. Whichever the system is having the poor functioning capacity, that system will be affected in the initial days itself.
Because with so many people, a bowel is so congested full of waste that, like you said yourself, constipation is the cause of so many illnesses.
Yes.
That when the bowel is cleansed, when the waste is removed, when the health-promoting bacteria are repopulated, we see so many illnesses fade away naturally. I mean, ultimately it's like getting a car that's the pipes are all clogged up, and you fine tune the engine and you get the pipes and you get rid of all the sort of blockages in the pipes, and then the car's running wonderfully and suddenly the car goes really fast and is durable and that sort of thing. And that's what we do with the body. It's like being a plumber in a sense.
Yeah.
Taking everything out that shouldn't be there and that way restoring vitality.
Sure.
Colonic toxicity easily promotes the rise of non-communicable diseases.
Well, this is what Ayurveda says, this is what naturopathy says. It does actually need naturopaths to drive forward some fundamental experiments showing that this is what happens, and that it's not just the traditions that say this, but this is actually based on 5,000 years of good experience.
How was her illness affecting her before she came? Was she able to do general everyday things? Was she able to brush her teeth and brush her hair?
അസുഖം നല്ലോണം വയ്യാതുണ്ടായിരുന്നു. നല്ലോണം വയ്യാതെ 8 മാസം ബാംഗ്ലൂര് ഡോക്ടറെ അടുത്ത് പോയി.
Before 8 months she can't do any work. She can't tie her hair.
So for the last 8 months she's had like absolutely no mobility, no use of the arm at all?
Yeah. Now she can able to tie her hair, and she can able to put her dress self.
Did she experience as much of an improvement as she thought she would, or did she expect that she'd have more of an improvement?
ഇത്ര ഇംപ്രൂവ്മെന്റ് ഉണ്ടാവുമെന്ന് വിചാരിച്ചിരുന്നു.
99% happy ആണ്. 99%.
So you're happy? Good.
He's happy 99%.
Good.
നേരത്തെ പറഞ്ഞതേനു ദൈവം കൊണ്ടുവന്നതാണ് ഇവരാ.
God's give her him.
God's given me to her. Oh, that is a serious compliment. Oh, thank you very much indeed. So now we're going to learn about the metabolic syndrome, what it actually is, and the role that Nature Cure has to play in treating the metabolic disorders. We're also going to learn about how it's inextricably linked to the lifestyle that we lead. Also in this section we're going to meet some patients who are being treated for just that.
We have n number of patients. Under me, I have treated many number of cases like this with metabolic syndrome. So that metabolic syndrome, so as you said, increased cholesterol, increased blood pressure, increased sugar levels, and increased body weight. So they are all interrelated. Increased body weight increases incidence of increased sugar levels, increased blood pressure level, increased cholesterol levels.
So Mr. Raghuram is about to be discharged tomorrow following 8 days stay in STM Nature Cure Hospital. So Mr. Raghuram, you were admitted with hypertension, diabetes and obesity and back pain. What was your blood pressure when you first arrived?
130/80.
130/80.
Right, so it's 130/80, but that was being controlled.
Yes.
With medication, correct?
Yes.
So now your blood pressure has been reduced to what?
ಇವಾಗ ಎಷ್ಟಿದೆ BP?
BP 120/80.
And any medication?
Here we don't give any medication.
Right.
It does not take.
So blood sugar levels were?
Blood sugar level ಹೇಳಿ 150
150
and 232.
and after food 250.
So fasting is 150, so that's
after food
high.
232.
And then postprandial after eating was 232, so that's very high.
Yeah.
So it's gone from a fasting level of 150 and after eating level of 252 or something like that.
Yes.
Down to what levels?
100.
Now it is
Fasting levels 100, which is perfect.
yes.
And after eating?
After food 118.
Good, and that's controlled entirely nutritionally.
Exactly.
No drugs given
No.
whatsoever for that.
So the first aim and objective of naturopathy is to correct the altered lifestyle. So what are we talking terms? So correction in terms of complete way of living itself. So naturopathy plays a major role, or that it should become the first line of treatment for metabolic syndrome.
Right.
Because so once you start medication to the blood to maintain blood sugar levels, lifetime you have to take the medication. If you take the cholesterol medication, the statins, and again you have to take for its maintenance for the lifetime medication. Blood pressure, without altering your lifestyle, you have to take the medication for the lifetime. So every system or every problem, if you are taking medicine, it is a burden to the body. 100% their blood sugar and blood pressure, their cholesterol levels, their body weight can be controlled very in a natural manner, without any medication, and definitely without producing any of the side effect to the body. That is very important.
And you came in here for like high blood pressure and to reduce weight?
Yes. My BP was about 170 by 110. Doctors are advising me to take the tablets, which I was refusing to take it because I don't believe in taking the tablets.
So when did like your present condition of hypertension begin to creep up?
Three weeks back, mainly because of my work pressure, because of my bad boss.
Right.
And then yesterday night it was 95 by 135.
Is that right?
Yes.
In a few days?
Yes.
Okay, so there's some stress factor in your life outside which is causing
which I am ready,
what you want to do is identify it and see what you can do about limiting it.
Yes.
And like allopathic system, they don't have any answer for the chronic diseases today, any answer for the degenerative diseases today, any answer for the metabolic disorders today, because it can only control, it cannot cure. So I suggest metabolic syndrome, naturopathy yoga is the best, because it will treat the body and mind in a proper manner, so that hypertension will come down, obesity will come down, diabetes will come down. So the person who is suffering from the metabolic syndrome, he will learn how to lead a healthy life.
Lifestyle modification, they must do it. There is no shortcut towards health. That's what they should know, and that's what we are teaching them when they are leaving from here.
Fasting is an integral part of the overall Nature Cure process. I visited a hospital, Mahatma Nature Cure Centre, that specialises in putting patients on fasts. In this section we're going to meet some of those patients. We're also going to come to learn about what fasting actually is, why is it included in Nature Cure, and some theory about how it actually works. How does Nature Cure actually provide the right setting for the body to heal itself?
So Nature Cure provides what is empirically known from experience as being the ideal conditions under which to restore health.
Fasting is the main technique what we use here for detoxification. What is the intention is like give rest to the digestive system, help body concentrate more on the detoxification process.
I am receiving treatment for diabetics.
I see.
My blood sugar level was 450, 485. Diabetics and little slight depression type I had after I got this sickness. I was getting angry, I was not interested in any work, I was angry with everybody.
Right, I see.
And then that all disappeared in this last 5 days.
And how much, so you've been here for 6 days, your blood sugar levels have come down to a normal level,
yes.
And you're not taking any more drug medication at all anymore?
Nothing. After coming here I stopped.
So you're happy to come off the drug medication?
A big relief.
Big relief.
Right.
In Sanskrit it is called Lankhanam Paramaushadam. Lankhanam is the stoppage.
Right.
Stopping is the Paramaushadam, means it is the divine medicine.
Right,
Fasting is the divine medicine.
That's very interesting.
So that's why we have to give the fasting along with the naturopathy modalities of treatments.
Right.
Then we'll get very fantastic results for almost all the diseases.
Langanam Paramaushadam. Langanam means fasting is the greatest medicine. So during fasting we get fever, cold and skin rashes, diarrhea, vomiting. Through that toxins are eliminated.
Does juice fasting have any particular advantage over
Yeah, it's very, because each juices has particular nutrients, which has minerals, which has vitamins, which helps to eliminate toxins from our body.
So I had pains in knees, knee joints and back and
so lower back pain, pains in the knee joints, pain in the hips?
Yeah.
Pain in the hips as well?
Pain in the hips. It starts from your back and then it
goes down.
Yeah. I was told it is the initial stage of osteoarthritis.
So you've been here for 21 days already?
Yeah.
And how, out of that amount of time, how many days have you been fasting?
20 days.
So you've been fasting, this is your 20th day on the fast?
This is the 20th day on the fast.
That's incredible, that's a really big fast.
Yeah.
How do you feel? Do you feel any better?
Yeah, my knee pain is totally gone.
So the back pain's reduced by how much, percent-wise? A little?
Yeah, probably 50% at least.
50%? Yeah. That's actually pretty good. So how do you break a fast?
Breaking of fasting is very important than taking a fast. The first time I'll give a half glass grape juice. The 2 days we'll be providing like this, half glass 6 times. And the third day onwards we'll give different kinds of juices. And so that very slowly this alimentary system starts working.
Nice.
Then we will introduce straight away different kinds of fruits. Then we will introduce salads, plant salads.
I see.
Then we'll put them on, after 2 to 3 days, we will put them on normal naturopathy food. That will be very sattvic, without masala, less salt, no oil, like this.
I'm 23.
23.
Yeah. So I've been overweight the whole life. There was one of my aunts who came here. She told me this is a place where people come like who are overweight and they find this treatment really good. So I was like, okay, I'll give it a try. When I came here, I was 94 kilos then.
94 kgs?
Yeah.
Okay.
So, and then I left, I was 86.
So when the body is on complete rest, there are a lot of changes taking place in the body. A lot. Because your hemoglobin level increases, your RBC level increases, okay, and gastric secretion decreases, pancreatic secretion decreases, and the re-establishment of the mucosa in the intestine, it happens, and also the lungs, it happens, and all the body, it rejuvenates actually. It strengthens the digestive capacity and whatnot. It strengthens the mental power, increases the memory, increases the eyesight. For each and every cell will be cleanses with fasting.
Yes.
That's what the naturopathy, the basic principle itself is, body has a tremendous power to heal itself if left alone. That opportunity is given by fasting.
I am 73 years old.
Right.
So I got thyroid problem.
Hypothyroid.
Hypothyroid. So I lost around 10 kg.
Congratulations, that's very good. You must be very happy with that.
Yeah,
10 kgs.
I am really, because of when I came from Bombay, I came by a wheelchair. I couldn't walk. Now I can walk. I got confidence to walk.
Can you talk about how fasting, through providing rest to the body, through abstaining from eating, actually promotes the restoration of optimal regulation?
The body has its own internal intelligence. The body actually knows what organs are in trouble and what organs are healthy. The body not only has a system of control from the top downwards, starting with the brain and the whole body, and moving through the organ systems, the organs, the tissues and the cells. It has this very democratic system of communication, which modern medicine doesn't recognize. Now, all the tissues actually know who's in trouble and who's feeling healthy. And the whole system has an automatic direction of life force energy to those tissues which are screaming for help. And fasting and allowing the natural intelligence of the body to function optimally allows the redirection of nutrients, correcting factors, the life force energy, and the body's innate intelligence in these forms to correct the tissues which are troubled. It's a system of unbelievable sophistication, hugely much more sophisticated, beyond the comprehension of the world's, most of the world's biological community.
Nutrition, what it actually is that we put inside our bodies, is fundamental to the practice of Nature Cure. So in Nature Cure, we take patients away from poor dietary habits, poor drink habits to dietary and drink habits that promote health, that boost the immune system, that promote alkalinity of the body. Another practice within the nutritional field in Nature Cure is juice therapy. We're going to visit Dr. Rashita at SDM Hospital, who's going to explain the various juices received by patients and for the particular conditions that those juices treat. I've spoken to other heads of departments, and everybody, they all do continuous with treatment, they all do clinical studies and research papers on their specific healing modality. Do you do the same in your department?
When we do the research studies with the juices, like the therapeutic effect of certain juices. Like so far we have did on the lemon honey juice and the skin diseases, and Musambi juice on obesity, beetroot juice for reducing cholesterol levels, and many more studies are going on with the PG students as well as the UG students. Beetroot juices were given on the empty stomach, and we found that the cholesterol levels reduced after the 10 days of beetroot juice supplementation.
For diabetes, have you done tests on particular fruits?
We have done diabetes with the bitter gourd juice. The patient got admitted here with a FDS 180.
Right, 180, so the top level should be 110.
Yes.
And
then with the 1 day introduction of bitter gourd juice had brought their blood sugar levels to 79. This was
1 day?
Yes, 1 day time.
79?
79. And the patient was on insulin, so we stopped the insulin completely, and it was just on bitter gourd juice. We are not supposed to use bitter gourd juice daily because it is a hypoglycemic agent.
Right,
so
clearly.
we have to monitor
Very
the patient.
Yeah.
We give juices 4 times in a day. We give carrot juice. Carrot juice we give mainly in skin diseases because it contains vitamin A, beta carotene. And then next about the lemon honey juice, we mainly give it for obesity. For acidity, we go for ashcot juice. Yes, we have beetroot. Beetroot we give specifically for anemic conditions. As well as beetroot juice, even it's good for reducing the cholesterol levels. As I said earlier, it helps maintain LDL-HDL ratio. So next comes Musambi juice, which we give finally. We give here 3 days of fasting, and we break it with Musambi juice. It's thicker juice. It's rich in all the vitamins and minerals. It's a complete juice, we call it here in our hospital, and we give it during the breaking of fast. The colorful juices are very good for preventing cancers and skin diseases. The coloring agents present, natural coloring agents present in these juices are rich in antioxidants, which will definitely help to promote the health as well as to prevent many of the cancers.
Nature Cure also uses hydrotherapy, acupuncture and massage. Hydrotherapy plays on the circulatory system of the body, delivering blood supply to various parts of the body, which in turn delivers nutrients to those parts of the body, accelerating the healing process. At the same time, Nature Cure also inhibits blood supply to various parts of the bodies, which can be used to calm inflammations. Let's see the various types of hydrotherapy applications that are given to various patients at SDM Nature Cure Hospital. I'm with Mr. Raj Shekhar and I'm with Dr. Chandrakant too. So Chandrakant, what has Mr. Shekhar been admitted for?
Well, Mr. Raj Shekhar has been come over here with the complaints of difficulty in walking.
Right.
So now he's had this surgical intervention, which was around 5 years back. This was a surgical intervention done for cervical stenosis. And cervical stenosis is something like a narrowing of the cervical vertebrae or cervical bones, the region of the back of the neck. So now he had certain nerve root impingements, and he used to feel those tingling and the numbness in his arms, and he used to have instability in his lower limbs.
Right, so he went to the doctor originally with numbness and tingling and weakness in the limbs.
Yes.
He had the operation and then it got much worse
Yeah, it
after.
got much worse. But right now he has come over here for much more palliative care, much more physical therapy, something like traditional Chinese medicine, acupuncture, and of course aquatic therapy. We're doing all our best. Since it's a nervous problem, it's something to do with the nerves, it does take its own time.
Acupuncture, why it is included in naturopathy? Because it is one of the drugless therapy. In acupuncture, they believe that the main cause for disease is imbalance between the yin and yang. That is, the circulation of qi is disturbed. So there are different concepts where we treat the patients. One is like based on the traditional concept and based on the neurophysiological concept. Here in this hospital, we are giving more importance on the neurophysiological basis. In our body, autonomic nervous system means it consists of two parts. One is sympathetic system, one is parasympathetic system. So sympathetic system is one which activates the system, whereas the parasympathetic system which balances. Similarly, in the body, these two systems, sympathetic and parasympathetic system, should function in a cooperative manner.
Right.
Coordinated manner.
Right.
So any imbalance in this, it results in the form of disease. So acupuncture works as biphasic, means if there is any excess, it brings down. If there is any deficiency, it again brings back to the normal.
During my time in India, I also visited a hospital that specialises in the naturopathic treatment of patients with kidney failure, Gandhiji Nature Cure Hospital. I met the respective doctors in charge of treatment and also had the opportunity to visit and interview some of the patients receiving treatment there.
A dialysis is a death sentence. But if you go to the correct naturopathy facility, like you have visited in the southwest state of Kerala, in the city of Thrissur, you find a naturopathy hospital which cures kidney patients alarmingly regularly.
So I'm with Srinivas here, and obviously he has chronic kidney disease, and we can see he has a chronic case of ascites, fluid retention in the abdomen. And how are you feeling? When you came, how were you feeling? Were you feeling weak? Very weak. Sick. Very sick, very tired. And I can see you have a fluid, water in your stomach here. So did you have like itchy skin or that sort of thing? No? And what was his creatinine levels when he was admitted?
The report says
7, approximately 7. Okay. So Srinivas will be here for about a month or a couple of months at least, right?
So basically, first they're going to observe the patient and
right.
then start treatment.
I see. Okay.
Always suggested from my side that the people should come before the dialysis.
Right,
that is on the grade 1 and 2, 3 stages of the renal failure is the best period where we can revive back the lost kidneys function.
Right. So basically the outlook for somebody that goes for allopathic medicine that does have renal failure is to have a dialysis for the rest of their lives,
yes.
or like an organ transplant, in which case if they have organ transplants and they're going to be on immunosuppressive drugs for the rest of their lives.
Yes. So when you take immunosuppressant drugs, what happens is your body itself is being spoiled totally. So they catch up another kind of infections, they get chest infection, they get skin infection, they get diabetes and many problems. So they cannot survive for a longer period. Whereas in naturopathy, once the kidney is revived back, the person can have a normal life as he can live as a normal person.
So do you actually treat any patients that come to you with kidney failure because they were taking drugs for another reason and they've ended up with kidney failure?
A large number of kidney failure patients are the contribution of the allopathy drugs, including analgesics. Painkillers. And of course the dye which we inject for the CT scan,
right.
in the angiogram they use dye. All those dyes are nephrotoxic. They damage the kidneys. So once the kidney is damaged, there is no other measure than going for a dialysis. So such patients can be revived back absolutely to the normal condition.
Right.
They can come back to absolute normalcy within a short period of 2 weeks to 1 month period.
Right. So you arrived last month with a kidney problem?
Yeah. Basically, I am a sugar patient.
Oh, diabetic.
Diabetic person. I am having 20 years
Diabetes.
Diabetes problem.
So you were on dialysis as
Yes,
well?
I am a dialysis patient.
Right.
Per week, two dialysis I am doing.
Twice a week?
Two, yeah. But after coming this area, after I am taking the naturopathy, I extended to 5 days per dialysis. Previously 3 days per dialysis.
So when you first came to the hospital, were you how did you feel? Did you feel like lack of energy?
Yeah.
Did you feel dull?
Just I'm feeling I'm revitalizing.
Oh, so you're feeling better?
Better.
How do you feel to stop taking the drugs? How do you feel? Does that make you feel happy or?
Yes, very happy.
Good.
Peaceful. And at the same time here I am learning the meditation and yoga also.
Oh, good. Very good.
Yes.
There are certain medicines which you take for the heart, cardiac ailments. They also have an adverse effect on the kidneys. So there are many drugs which has got an adverse effect on the kidneys. There are certain antibiotics also which has got an adverse effect on kidneys.
Right. When you treat people, what's the nutritional protocol here?
The patients who comes to us because of the nephrotoxic drugs that the kidneys have been damaged.
Right.
For them, once the kidneys are revived back completely, it is not required, it is not mandatory that they follow all the diet or they keep a discipline in their life. But there are certain problem which has been occurred out of diabetes, out of hypertension, where there is a chronic damage has happened to the kidneys and the kidneys have revived back. For them, it is mandatory that they should follow certain disciplines in the life, in the part of the diet, and as well, they should not take indiscriminate drugs.
Right.
Over-the-counter drugs should not be recommended at all. We boil the vegetables and take out the water, discard the water, so that the potassium content reduces. So it gives less pressure on the kidneys.
Is there any protocol with the amount of protein?
Yes, of course. According to our concept, we suggest the patient should take vegetable source of protein instead of animal protein. 1 gram per kg body weight is the amount of protein required for the person.
Right, so 1 gram. When you first arrived, what were your creatinine levels?
Creatine 18.
18?
18.
So that's very, very, very high. And the creatinine is now?
11.2.
Oh good, so after 2 months it's now down to 11.2.
11.2.
So you were receiving dialysis before?
Yes.
How many times a week?
Weekly 2 times
in the beginning, 2 times a week?
2 times.
And now?
Weekly once.
Weekly once. And soon you'll hope to stop dialysis altogether, correct?
8 point of the dialysis stops.
Oh, when you go down to 8?
Yeah.
Right, oh, okay. Okay, good.
Recently, we had one of the top doctors in European study of the complications of diabetes. And when I told him about the data that we had on naturopathic and herbal medicine cures of kidney problems, he was absolutely amazed. He said there's nothing like it. Nothing like that in the literature. It's a really good topic for further research.
Previously, exercise used to play a major role in Nature Cure, in the treatment process of Nature Cure. Now, it's been replaced by yoga in India. Yoga therapy plays a vital role in the practice of Nature Cure in India. I had the honor to interview Professor Satbir Khalsa of the Harvard School of Medicine and also Heather Mason, the leading yoga therapy expert in the UK.
When they come here, they may have the physical ailment, they may have something like back pain and this and that and stomach disorders and all those things. When I see them, then when I talk to them, I realize there is something which is a complaint, a bad feeling, an anger, they're stomaching, they're just holding it themselves. And it is very amply said in the Indian text that whenever we hold these negative things, they percolate into physiology, whichever is supposed to be the weak link in the in the physiology. Like for somebody it may be the back, for somebody it may be the stomach, for somebody it may be the gastrointestinal level. Because by talking to them, I try to remove the anger that is hidden in them, or the hatred that is suppressed in them, jealousy that is stored in them. I try to remove them by talking so that I can create a harmony in their heart.
A lot of people say that, you know, when they practice yoga, when they practice meditation, it alters their mindset, it even like modulates or changes their personality. Is there any sort of explanation for that, how it sort of like touches us on a deep emotional level?
Most of that change will probably come from a meditative practice. Because when you control your attention in the practice of meditation, you are changing the way your brain behaves. You are no longer ruminating, you're no longer mind wandering, you're now focusing your attention. So as you do these practices over time, you develop essentially a meditator's brain, a yogic brain. And a lot of times during deep relaxation or during deep meditation in yoga, people start to experience this unitive state, this state of flow, this sense of everything is one, there's a sense of timelessness, there's a sense of peace and harmony. And that experience is deeply profound. I mean, even if it lasts just for a second or two, this sense of a deep unitive flow with yourself and the rest of the world around you is a very profound and life-changing experience. And it can change people's values. So that, I think, is the most profound mechanism by which these meditative practices, the meditative component of yoga, can really change one's perspective on life and one's values and one's goals in life.
According to the yoga philosophy, that human being is not just only the physical being, but he's also the vital being within, and the mental, emotional, intellectual, and then finally, he's a spiritual personality, or called as the bliss personality. So we have deep inside, as our own nature, the spirituality or the bliss personality of ours. So when yoga gives us a technology, a methodology, it works at all these 5 different personality levels. Nature itself is health, healing. In fact, nobody can give me healing from outside. Healing is my own nature. Yoga is something which will bring you back to your nature, which is supposed to be health.
Is yoga exercise, or is yoga different from exercise?
100% it is different from an exercise. Because, see, yoga, exercise has its own respect and good, but if exercise has a very limited effect on mind, where yoga coordinates with all its practices body and mind. Number 1, after exercise we feel tired, but after performing asana we are feeling fresh. And even for the heart, whenever you are performing some exercises, heart rate is increases. Whenever you are performing some yogic poses, heart rate is reduces. Even for the muscular system, various research has conducted. Muscle tiredness is more through EMG study after exercise. Muscle tiredness is reduced after practicing asana.
For the proper movement and proper digestion, the exercise is a compulsory thing. It's a must. And whenever we are having the muscular strength enough to support the digestive system, there will be proper peristaltic movements so that the food can go to the proper channel easily.
Right.
That is the major thing. Then once the digestion is happening, all the nutrients should reach to the cellular level. So how all the nutrients along with oxygen and water can reach the mitochondria of the cells? It can only happen through the bloodstream. So we want a proper blood flow throughout the body, especially all the peripheries or the extremities, almost all the parts. We want the proper circulation. So without having a proper exercise regime, it is not possible at all. One thing. And one more thing is that exercise is a stress reliever. Around 60% of the diseases are psychosomatic. If you are in a proper exercise regime, definitely it can reduce the stress level too. So it is good for the nervous system, it is good for the cardiovascular system, it is good for the respiratory system. So it is definitely is good for the entire body.
So tell me a little bit about your institute, the Minded Institute. What is it?
The Minded Institute is really a multi-tiered umbrella organization that has a few different purposes. One is to provide healing to individuals who are actually suffering. And I also offer public events, conferences and whatnot to inform the public at large what the benefits of these practices are.
So benefits for what sort of issues or conditions?
So mental health is first and foremost. Depression, anxiety disorders, post-traumatic stress. Interestingly, a lot of research is coming out right now around schizophrenia. And then there are things like diabetes, heart disease, chronic obstructive pulmonary disorders, and there are a lot of other conditions as well, cancer. There's a really big trial going on right now at MD Anderson, which is one of the premier cancer hospitals in the world. There's a big trial for the use of yoga as treatment as usual in breast cancer. And there are few teeny trials to suggest it may enhance positive prognosis. So I think it's a really exciting field. There are very few side effects. The benefits of yoga as a practice far exceed supporting somebody to overcome a disease state, enhances quality of life, enhances behaviors, enhances overall well-being, and you don't really get that from medication.
I was suffering from the IBS problem, all digestive disorders, and things were moving like I'm not living, I'm not lively, I'm just living. Now I'm feeling like let me live longer with a great joy, peace in mind, and great happiness.
You had IBS, so you had a lot of gas and bloating and that sort of thing?
I need to go to the motion for at least 7 to 8 times, which will disturb my whole schedule whenever I want to travel somewhere, whenever I want to attend some conferences. It is an obstacle for me. It was 10 to 12 years.
Oh right, so you were suffering from IBS for 10 to 12 years?
Yes, it was chronic. Now I can say that in 5 days I have achieved the result of 10 years, and I am thinking now to be a part of long distance learning for yoga.
Oh really? So you're going to do a distance yoga learning course?
No. Yes.
Oh congratulations, that's absolutely excellent.
I have brought together a bunch of different professionals within this country, all who have a very prominent role in either research or the use of complementary practices and lobbying for them within Parliament. And we've created a group of individuals that is trying to go to Commons and make our case and work with MPs. I'm really interested in clarifying for the professionals that work with these conditions what the mechanisms are that underpin their benefit. You know, the body has this natural potential for healing, and we exist specifically in the modern world, but I think it's part of our biological makeup in this state of sympathetic arousal and activation. We're using up the body's resources all the time in that state. And when we return to a state of calm, of parasympathetic activation, the body's capacity to rebuild, to inhibit inflammation, to enhance its level of oxygenation so that cells are working at their maximum capacity, so that free radicals can be wiped out of the system by some of our natural antioxidants and by addition of high levels of oxygen saturation. I think that has a great effect. The knowledge now that for some reason moving and breathing in combination increases levels of a major neurotransmitter, GABA, which is the major inhibitory neurotransmitter, more than other forms of exercise. And that when we enhance this neurotransmitter, we inhibit our fear network, we reduce sympathetic arousal, that then is going to lead to our body again entering this state of natural capacity for healing. And the fact that you have this coordination between slow, controlled movement and slow, controlled breathing, that really enhances that parasympathetic capacity. When the body feels strong, you feel well. When you feel well, the body feels better, and it becomes a cyclical loop. Yeah.
I had trembling from head to toe.
Trembling?
Trembling accompanied by severe pain all over the body. I could not even hold a piece of paper at times. It would pain so much. And I've been put on antidepressants for the past 6 months. All in vain. Sure, I was told that I am depressed, thereby I have the pain. I was depressed because of the pain,
right,
and not that the depression caused the pain.
Absolutely,
I disagreed there. Then all kinds of tests were done. Finally, a rheumatologist told me that yoga could be the only solution. Cool. This is my 3rd week. I'm going back tomorrow because 90% of my pains are gone.
So you must have a whole load of things you now want to do when you get home.
No, I'm very keen on learning more yoga exercises.
Good for you.
And I thought it would be nice if I make yoga my lifestyle. So if I can learn enough yoga to become a teacher,
Oh, wonderful.
I would love it.
Oh, wonderful. Oh, congratulations.
I think there are two other mechanisms that are really important to take into account for yoga's therapeutic benefit. One is that we know that yoga causes the release of oxytocin. That's our cuddle hormone. Higher levels of oxytocin are important for two reasons that would enhance our health. One is it gives us a greater sense of connection to other people. And when we feel more connected, research has found the progression of disease slows down, the rate of healing increases. And also, oxytocin is an inhibitory factor for many of the inflammatory markers, things like cytokines. So that's really important. And another is that yoga activates the vagus nerve. I think it's really exciting what's possible. And I myself have suffered from depression, anxiety, post-traumatic stress. And I've used mindfulness and yoga to help myself. So I'm very passionate about sharing that with other individuals. I want to see them benefit in the way that I did.
One of the very common theories in yoga practice is the so-called vagal system. This is the parasympathetic system within the autonomic nervous system. And we have vagal fibers, vagal nerve fibers that are known to go from the brain to the body. And those are fairly well characterized. But what's not so well known is the fact that the majority of the vagal fibers are actually coming from the body to the brain. And we really don't know what these fibers are doing, but this is part of what's called the polyvagal theory. The idea is that these vagal fibers, these afferent fibers, conveying information from the body to the brain, are conveying information about the body. So presumably, it could be that when you do some kind of stretching posture in yoga, you are activating these vagal fibers, and these are making changes in the central nervous system activity.
My ultimate ambition was to see yoga integrated into healthcare. I'd like to see yoga therapists in every hospital. I think that they have a place, you know, and I'd like to see a yoga therapist potentially as an NHS career.
Due to the growing body of scientific evidence for the benefits of yoga practice, it's now being pushed into schools in India so that school children can also benefit. But as we're about to see, it's not just in India where this is taking place, it's also happening in the United States, where a body of people are in the process of installing yoga into the school curricula. I say that should happen in the UK as well, so that our children can also benefit.
Believe me, when you look at the mental health characteristics of our children and adolescents in modern society, the results are extremely alarming. We're talking substance abuse, anxiety, depression, etc., etc. So it is a huge burden, and our schools know that they have this burden. And the problem is they don't have the behavioral practices or the skill set within the schools to deal with this. Yoga is exactly such a practice.
I think introducing it into schools, well-being practices, be it yoga, be it tai chi, be it mindfulness, be it a combination of all of that, sets young people up for a lifetime of self-care that will enhance their overall well-being as they age.
We have seen the intelligence of the students has been increased. That is, mainly IQ power has been increased. The examination result was so much advanced in those children, and discipline of the students has been improved, and regularity to coming to the school has been increased. And moreover, overall personality development we have seen in the children who are attending lower classes. So yoga is meant for the overall development of all the children.
So yoga in the schools would help them to be fit, to improve their personalities. So as I said, yoga is effective on all the levels of personality, maybe physical, mental, emotional. So they can face the world in a better way. And then yoga improves the memory, yoga improves concentration, attention, all sorts of things which are required for a student.
So the school will be producing better people and better students?
Absolutely, better citizens for any nation.
laboratory for the past 10 years has really been primarily devoted to studies, research on yoga in the public schools and its benefits. So this is an area that's growing in popularity. There are now many programs. We published a number of papers. One of these papers is a survey of the number of programs in the U.S. that are organized curricula for yoga in public schools. And there's 36 of these that are well organized, have websites, and they have training programs for their teachers. We've also published a paper reviewing the research literature on yoga in schools. And we are showing that basically it's fairly safe to say that most of the benefits we see in adults are also apparent in children in the school setting. So we actually see children reporting that they're eating less junk food. Now, we didn't give them any instructions on junk food, but they're stopping the eating of junk food because they're no longer feeling comfortable with it. We get stories from kids who will say, you know, I always shout at my brother or my sister. We always get into an argument. And then the other day, I was just about to shout at my brother and hit him, and I took a slow, deep breath and decided not to. And so there's this option, there's this ability to self-regulate your internal reactivity, a sense of control, a sense of self-control that wasn't there before. One of our schools that we did early studies in, the Kripalu Center for Yoga and Health, which has supported a lot of our yoga in schools research, has continued to teach yoga classes in this one school. And after a few years of that, we did a focus group with some of the school administration. And one of the quotes from the counselor who was at the school, he literally said, yoga has made our school a better place. When you change the individual and their behavior, you change the school classroom. As the classroom dynamic changes, and all the classes are experiencing this, of course, the school changes. If you do this in a district where you're doing multiple schools, you're going to change the district itself. And then you keep going out, and ultimately, you are basically changing the world. That's one of the beauties of bringing yoga into the public school system, is that you are now giving yoga to an entire generation. If we can implement yoga into every school in the country or in the world, we will change, after 3 generations, we will change society, because everyone will have experienced these types of self-regulation and awareness practices. And that's a game changer.
Naturopathy has a considerable understanding of the body's innate ability to heal itself. It doesn't state it in quite the sophisticated modern ways that I've learnt to describe it, but these are empirical methods which have been shown to work. We have a huge potential of looking just at what naturopathic medicine says and understanding it from a scientific viewpoint.
It is our responsibility to take our health.
Right.
Keep up our health. Okay? No hospital and no doctor can make you healthy. Actually, you have to choose which way you have to go. And that is your responsibility to keep your health always. There is no shortcut towards health.
Nature Cure has no potential for side effects. We use water. Everybody has a bath, goes in the sea by the beach. How can there be a side effect when you're having a hip bath or a full immersion bath, or you've got like an ice pack on your sort of like chest or back for a kidney pack or something like that?
Completely back to nature, isn't it?
Absolutely,
Yeah,
completely
yeah.
and utterly. But that's the thing about Nature Cure, it's completely and utterly back to nature. Water, ice or steam, nutrition, fasting, juicing, yoga. This system of healthcare in its sort of embryonic stage was practiced in England around the 1700s and 1800s throughout the entire country. Hydrotherapy was used in hospitals throughout the entire country. So my ultimate goal is to install the Indian system of Nature Cure in this country, starting by promoting it via yoga naturopathy conferences.
Rob, I find you a very inspiring person. I just love to be with you, because when I'm with you, I'm like, yes, it can actually happen. I mean, as you know, I'm trained naturopath, acupuncturist, and completely believe and have seen for myself through my patients miracles that are possible.
I've finished my India trip right now, and I've got 2 weeks left, or just under 2 weeks left. I've visited a range of different places. It's been a very, very enriching experience, I must say, all in all. When I first came to India, I had absolutely no idea whatsoever that I'd actually visit a whole lot of different hospitals. That was completely unplanned. So originally the whole idea was for me to just go to Dr. Shimji's hospital, Saukyam Hospital, and I'd imagined being there for 6 or 7 months, working, practicing, learning, and at the same time producing trying to make a documentary. But it was him that said to me, look Rob, you need to go to other hospitals, I want to send you to sort of different places so you can experience different clinical environments, and each one has their own unique way of treating people. Because of that, the whole experience was so much richer, and I never really imagined that I'd get to sort of visit all these different places and actually even interview all these different doctors and meet all these different people. And on that level I'm so lucky, it's unbelievable. And to be very honest, for example, when I first got to SDM, Nature Cure and Yoga Hospital, and I met the principal there, Prashant Shetty, and he sat me down and said, right Rob, you're going to interview all the professors, you're going to interview all the assistant professors, you're going to interview all the heads of departments, etc, etc, etc. I was on the phone with my girlfriend like that night or the night after saying like, wow babe, you know, I don't know if I can like handle all this, sitting down talking to all these different professors. Am I up to it? Am I knowledgeable enough? Am I skilled enough, you know? And then, you know, once I started, I guess there's no looking back really. So I was on the phone to my girlfriend a few nights later and said, you know what babe, this is like totally easy. So when someone in the UK wants to be treated and they don't want to go and take drugs, they don't want to see the GP or the family physician, they'll do their own searches, right? On Google, they'll find out for themselves if you know, someone might be good at acupuncture or herbal medicine. They'll read some like testimonials on the website and, you know, put 2 and 2 together and see what they can kind of come up with. But that's not how it should be done in the slightest bit. When you get treatment for a chronic disease, integrated set of treatments should be carried out in one centre, and one centre alone. We need nature cure centres. People need to come and treat themselves in the same centre. People need to go to a centre, check in for 10 days or 2 weeks or 3 weeks or whatever it is, and receive an integrated set of holistic treatments. So the practitioners will say, right, this is your nutritional regime, this is your diet, this is the exercise, the yoga that you'll be doing. Here's the pranic breathing techniques. Here's a fast you'll be doing for 3 or 4 days. Here's some acupuncture you'll be doing. You'll need some physiotherapy for that as well, you know? Hydrotherapy, hip baths, spinal baths, full immersion baths, jets, everything in the same centre. That's how it needs to be done. So I truly hope that I've managed to convey to you the full power and healing potential that naturopathy can actually play when professionally applied in a clinical environment. You've had the opportunity to listen to not only the world's leading experts, but also to view the recoveries and treatment processes of patients with a number of different illnesses. And so I'm really hoping this has been very insightful and also inspirational for you too. And I'm really looking forward to the day that naturopathic rejuvenation centres are installed here in the UK, where patients receive a truly set of holistic treatments and we can all go on to lead healthier and happier lives.